there is a closing topic that we want to hit because it's probably the most important one. And that, of course, is the New York Health Act. We saw what just happened in California. Probably not that surprising. But we've always maintained that New York is really the state that we see is the one that's going to break through, is the most likely to break through. You have a lot of great assembly members and state senators that are really championing this issue.
We had Senator Rivera on,
who was great. You've got Jabari Brisboard, who's really great. Mr. Kim, who's really great.
We're so jealous.
You guys really have some really good representatives. And so what is going to be the difference in your observation? Because there's also a lot more true progressive federal candidates in the state of New York than there appears to be, with all due respect, in California. There's a handful, especially in Southern California. But New York, it really seems like there is this groundswell that really started with AOC's win, and it just continues to grow and grow over time. So what do you see is going to ultimately be the difference in 2022 and beyond in New York versus what just happened in California?
I think the first thing to observe is that, as I said before, coalitions, the campaign for the New York Health Act has been growing and building their coalition, and it's going to be the groundswell that we need from the grassroots and labor and, just statewide. I mean, this is, so we're talking about a fundamental change to, our healthcare system in New York, but that also is the seed for the change that we'll see nationally. So New York does it right and will be the model, and you'll see states following us because they'll say this is how it's to be done. The GDP for New York is like $1.8 trillion or something. If I remember, it's bigger than Canada. So I mean, we have the capacity to fund this.
Yeah.
And it's an issue that when you talk to people about it, I know Melanie talks to people about Medicare for all. You get past the buzzword, because you get into like, do you want to pay copays? Do you want to be able to see any doctor you need to see and get any treatment that you need to get? This is the way we do it. We already this is something that's really great. I mean, it's like, you're going to tax everybody and all that. There's going to be more taxes, higher taxes. You already pay and don't get the service that you pay for. It's called the benefit contribution in your paycheck when you get the health insurance from your boss, right? They make a contribution, you make a contribution. Well, you're just changing the way that contribution is going down and who it's going to. It's going into the single payer healthcare system. And you're going to get for you, your family, your grandmother, whoever, everyone's going to get what they need, whether it's immediate attention. You get a splinter, you get cancer, you're getting treatment. Okay. This is what the New York Health Act promises. Okay. Long-term care, vision, mental health, dental. How many people don't go to the dentist because
luxury bones? They're luxury bones.
Luxury bones, right? So we can argue and we could talk about this, and it really is going to come down to political will. The people want it, they need it, and it's really pushing the political will, and that's leadership. Governor Hochul, I don't think she's going to do it.
Nope.
I really don't think she's going to do it. I think that if it came on her desk, that she would just get, nope, not going to sign it. So, and then we have to worry about the leadership in the Senate and the Assembly that are going to put this to the floor to vote. But we need candidates that are also going to be pushing for this, and that's Jumaane Williams. Jumaane Williams is going to fight. He's going to fight for single payer healthcare. And that's what we need. I mean, this is the fundamental. This is the fundamental change that one of the fundamental changes that we need in our society, because it is going to directly affect all of us. And Bob and I know, Melanie knows, we know people who have died because they didn't want to pay a copay. They couldn't pay a copay. There are people that we hear the stories all the time. They don't have the money for the insulin, or they're rationing it, or whatever it might be.
Or they want their kid to go to soccer, so they don't go to the doctor. This is not unusual anymore at all.
No,
It's
the medical
really not.
bankruptcies are off the chart too. I mean, that's something like more than half of our bankruptcies are medical bankruptcies. That's embarrassing for us. Like,
Yeah.
that's just not something that
We're
that
the only
is-
developed country on earth that has that.
Yeah, it's absurd.
Yeah.
And I've always thought that too. Like the single payer healthcare would be the one thing that would help the most people in the shortest amount of time,
Right.
have the biggest impact, hands down. And the people, and also
And
be a
it would
boost
help the
to
economy.
Yes.
Yeah.
Yeah.
And when they were-
Candidates.
Bob, get in
Lower
there.
property taxes.
Yeah.
A significant amount of our property taxes go to benefits.
Right.
And it would
So-
create
would go
jobs.
down with the New York Health Act.
Yeah.
You know, Steve is online here. I see that he gave us a message for Steve is well aware of all the savings that would happen, literally county by county throughout the state. And then when I mentioned both the New York Health Act and Medicare for All are deflationary. They're not inflation. Not going to raise taxes. If anything, by getting rid of all the middlemen, you know, all the private insurance companies, prices are going down. You know, it's a question of, you know, how much.
And this is something we can't do alone. I'm going to put it to the rest of the nation. You want single payer healthcare? Turn your eye to New York.
Yes.
Help us with this, because
Help
if
us
we
with the
get it
message.
passed here, it's going to go. I know it's going to go to Jersey. It's going to go to, you know, Massachusetts. It's going to go to the Northeast. They're going to do it.
And then it's going to go nationwide. And it really does need to go nationwide.
spread. And that's what we have to do. That's something that we
Like
have
a
to
bad
do
rash.
is a national movement.
Hopefully a good rash,
You know.
actually, Jen.
Does he
Or a
think
rash
it's
that
gonna
can be
spread?
treated.
I don't know.
I'm
it-
picturing the outbreak
Right.
map.
It's
rash-
a rash that can be treated because we'll have
A ra- a
healthcare.
rash
and
without
it'll
COVID.
go so
Listen,
good.
I'm from the Soprano State, and as even though we get all the crap all the time from New Yorkers, the one thing I can say is that government is run 10 times better in New York than it is in Jersey. I wouldn't even think for a second that anybody would argue that point. And so it is going to take one major domino that's going to have to fall in order for it to really spiral, because that's how it happened. That's how it happened with cannabis, and
And
it
it should
eventually
be New
spread.
York. It
you
should
know.
be New York. Look, California and Colorado had weed. You guys could have healthcare, and we
Yeah.
could just
we got
sort of,
weed
you know,
now
we-
too.
Yeah, we do too.
I know we have nothing.
Can
How
I
about
just
that?
add a little
So
bit
this-
to this
so this-
conversation? Is that okay? Can I make a
Yeah.
couple points real quick? Would that
Yeah,
be okay?
please.
So one thing, you know, we've been talking about it for years, and Joe mentioned it. You know, it's choosing between, you know, getting your insulin or paying your electric bill, et cetera. But, you know, there's a whole new driver happening right now in the realm of COVID-19. I'm a mom, as I know you all know on this call here on the screen. I'm a mom of 3 children that are all in school. They're 11, 7, and 5 years old. And if they're sick, if they get a fever, they have to go get a COVID test. So I have to take them to the doctor. I have to get a COVID test. I have to keep them home. I have to wait 3 days. I have to, you know, and get it. And that can be, you know, a real barrier for working families. You know, it's even hard for us to, I mean, and thankfully, you know, we're like, okay, well, we've got to go take our kid and we work it out. But it's really hard for us with 3 kids trying to take them to, right. And that's a whole new expense too. So I wanted to mention that because I think it's really important, but just to build a little bit on what Joe was saying about how do we get here and why do we feel like we're closer than ever? You know, Joe started talking about coalitions, and I think, you know, we all know organizing, right? It's a movement and it comes and then it crumbles and then we've got to start all over. But right now we are, and I think Joe was right. He alluded to, we're figuring it out. We figured out how to work together. And, you know, I think the Invest in Our New York campaign was a really good example of that, where there were organizations that came together that said, well, I'm really not going to get what we need as an organization, but I see this as the first step. And then after this step, then we'll work on my issue next time, as Joe said. And we did a damn good job, you know, and now we're bigger and we're stronger and we're a formidable block to contend with. And I think these things all work together, because when we talk about electing bold progressives, right, we have to look at the geography of New York. Historically, you know, seats closer to Manhattan have been more progressive, right? Folks living there are just a bit more progressive, so it's easier to elect progressives. It has been more difficult in other regions, and this is why I think what's happening in Long Island and in even Northeast Queens has been really, really exciting, because now all of a sudden you are having candidates run for Congress and they're running on progressive platforms. Joe ran for assembly on a wildly progressive platform. It was amazing. And when that happens, even if we're unsuccessful in the sense that we may not have become elected, we have shaken up that district. We have blazed a trail. We have educated folks. We have brought folks in, and that's how it really starts. And unfortunately, it's hard to ask people to run for office. It's a big sacrifice, as many of you on this call know. But when we do that, we inspire someone else to run. Right. And so I think it's those two pieces work together. But then there's also a third piece that I think are, offshoots of both, which is your sort of neighbor to neighbor discourse. Right. And I always talk about my grandma. My grandma just passed away last month, but she used to always say to me, Melanie, it's not polite to speak about politics, and you're always speaking about politics, And I would say, well, I disagree. I tell my children that it's very polite to talk about politics because that's how you help the world. That's how you become a good citizen. And, it's this idea that we can have hard conversations about uplifting our communities, right? And I think all of these three pieces really work in tandem because they all contribute to the change, So but you have to start, and you have to know that as much as we want change tomorrow or last week, and we do want it, sometimes we have to kind of ready ourselves for the journey, right? Which is that this is going to take some time, and every year we build, we're going to get closer and closer and closer and closer. And that can't feel like a loss to us because sometimes, especially, my generation and younger, we're used to this sort of instant gratification. Well, I just worked my butt off for a year or 2 years. Why didn't this happen? Right. It's an important piece, especially with young folks, right? Like coming in and even my generation, folks that are, newly engaged in politics. It's really important to set those expectations. Yes, these are the goals. This is what we're trying to do. But if we don't get what we want, it doesn't mean we throw our hands up and walk away, right? We've just become closer. So I just think that's important as well.
Thanks for watching. If you want to support our mission to transform politics into service, please like this video, subscribe, follow us on social media, and consider joining our Patreon, where you'll get early access to our interviews as well as other exclusive content. Links are in the description. Peace out.